All right, everyone. Today we're tackling a critical neonatal condition, respiratory distress syndrome due to Meconium Aspiration Syndrome, MAS. It's a situation where every second counts, and understanding it thoroughly can help save lives. Imagine a full-term or post-term newborn struggling to breathe immediately after birth. What's going on inside those tiny lungs? Let's break it down. Description. First, let's define what's happening. MAS is like a roadblock in the newborn's lungs, caused by meconium, the baby's first stool. Instead of exiting the body harmlessly, it enters the amniotic fluid and can be inhaled. Here's what you need to know. 1. When does it occur? Usually in term or post-term newborns. 2. Why does it happen? The exact cause isn't fully understood, but it's linked to stress in the womb. Stress triggers the baby to pass meconium into the amniotic fluid. 3. How does aspiration occur? It can happen while the baby is still in the womb or during their very first breath after birth. Now, picture this. Meconium blocks the airways, traps air, and inflames the lungs. This can lead to severe respiratory distress, and that's where we come in as healthcare heroes. So how do you know a baby is struggling with MAS? Let's put on our diagnostic caps. 1. Respiratory distress signs. Tachyp breathing, cyanosis, bluish discoloration, retractions, chest pulling in with each breath, nasal flaring and grunting, crackles and raunchy on auscultation. 2. Yellow-green staining. You might see this on the baby's nails, skin, or umbilical cord. It's a clear sign of meconium in the amniotic fluid. 3. Chest x-rays. They'll reveal patchy infiltrates, air trapping, hyperexpansion, and areas of atelectasis, collapsed lung. What would you expect if you saw these signs in a newborn? Yes, immediate intervention. Interventions. All right, here's the action plan. The care depends on how the newborn presents at birth. Let's go step by step. 1. If the baby is crying and active, no intervention is needed. The lungs are likely clear of meconium. 2. If the baby is inactive and not crying, first step, perform endotracheal suctioning immediately. Picture this as a vacuum clearing the airway blockages. If respiratory effort and heart rate are low, provide ventilation, oxygenation, and CPR if needed. 3. For severe cases, some babies may need extracorporeal membrane oxygenation. Think of this as a bypass machine for the lungs. It gives the baby's lungs a chance to rest and recover, reducing pulmonary hypertension and improving oxygenation. 4. Ongoing care. Monitor for infection. These babies are prone to pneumonia. Support parents emotionally. They'll be anxious about their newborn's condition. Expanded clinical context. Instructor. Now let's dig a bit deeper into the big picture. MAS is preventable in some cases. If we suspect meconium-stained amniotic fluid during labor, close fetal monitoring is key. And when the baby is delivered, rapid assessment is crucial. Here's a pro tip for your exams. Always remember the ABC rule: airway, breathing, circulation. When a baby with MAS is struggling, your first priority is to secure the airway. Write that down.